Good day, everyone, and welcome to the sixth episode of the webinar series Unbottling the Truth, brought to you by the UP Manila National Institutes of Health Promotion Program. Today's topic is the gendered targeting of alcohol industries. My name is Bill Wilson Balhon, and I'll be your moderator for today. The alcohol industry has increasingly tailored its marketing strategies to target women, using gender specific messaging, branding, and advertising to normalize and encourage alcohol consumption. These tactics often exploit themes of empowerment, social bonding, and self care while downplaying the health risks associated with alcohol consumption. In observance with the National Women's Month, this session will critically assess the marketing strategies used by the alcohol industry to target women. And our speaker, Dr. Gianna Gayle Amul, will explore how these tactics influence drinking behaviors, the public health implications of increased alcohol consumption among women, and ways to promote informed decision making and regulation. For everyone's guidance, this webinar is pre-recorded and it will begin with a short presentation, which will run for about 30 minutes. Afterwards, we'll move on to a quick Q&A session. And if you have any questions, we will be compiling them from the comment section and we will be answering them after a few days through your email. Now, it's my honor to introduce our speaker for today, Dr. Gianna Gayle Amul. So she is an advisor on alcohol, drugs, and development at Forroot, Norway, and a non-resident research fellow at Ateneo de Manila University. With over 15 years of experience in policy research, she was recognized among the world's top 2% scientists by Elsevier and Stanford University in 2024. She has held research and policy roles in institutions across Singapore and the Philippines, consulted for WHO and ASEAN, and contributed to global public health initiatives. She currently serves as Secretary of the Asia Pacific Alcohol Policy Alliance, APAPA, and is on the editorial board of Globalization and Health. Dr. Amol holds a PhD in global health from the University of Geneva with distinction of summa cum laude and has authored numerous publications on alcohol and tobacco control, health security, and public policy. Dr. Amol, the floor is yours.
The title of my presentation is on gender targeted alcohol marketing. And what we're covering has been mentioned earlier, but in brief, I'm going to cover the historical evolution of alcohol marketing and its current trends. I will also cover the role of digital and social media platforms in alcohol advertisements, the psychological and social tactics employed by alcohol companies, and the health risk associated with gender targeted alcohol marketing and how they influence drinking behaviors. So let's just go through a quick overview of how alcohol marketing has evolved. And it kind of just started mainly when advertising became a professional industry in the early 20th century. So from traditional media with newspapers, magazines, television, radio, and film, it evolved into being placed, or the brand or the products being placed in films, music videos, and television shows. And now we have digital and social media, Facebook, YouTube, Instagram, TikTok, X, Snapchat, and what have you. And then, of course, we also have targeted advertising, which is what we're going to discuss today. But we also have, in line with that, lifestyle marketing, branded merchandising, celebrity endorsements. That we have a lot of that in the Philippines, expert testimonials, and this usually comes in terms of cocktail recipes by experts. And then also, of course, we have ambassador programs. And now there's this trend of celebrity alcohol brands when celebrities launch their own alcohol products. And of course, the inevitable influencer marketing. So let's look into the literature on digital alcohol marketing and gender. So digital alcohol marketing is designed to reflect traditional and evolving gendered stereotypes, activities, lifestyle, and roles. So the alcohol industry has leveraged a diversity of idealized feminine identities. And it's quite interesting how they have kind of integrated everything from the traditional feminine identities of nurturing, attractive, heterosexual, passive, vulnerable, and virtuous, to the contemporary feminine identity of exhibiting independence and female empowerment. So, in 2020, there was actually a piece in the BBC where it discussed the feminization of alcohol marketing, where you have the pink wine, the glitter wines, or the mummy wine time, or the wine o'clock, where they serve to both patronize women into getting to buy alcohol, and also in many ways damaging women and women's health. So let's look at the pink drinks trend first. So often the pink drinks trend would come in the shape of course, colorful drinks. The drinks themselves are pink. They would be stylized in packaging, pretty packaging, feeling, and it makes you, when you look at it, it feels good. And then you think that you are also attractive when you hold it. And it's most of them are made for Instagram. And a lot of them are ready to drink spirits, cocktails, wines, and also certain spirits that are designed that way. Most of them come in sweet and fruity flavors to adjust to the flavor palette of women. And of course, the pink, slim, and pretty packaging that we have, or that they market, um, alcohol targeted to women. And of course, the most important thing for them is that they are marketed as healthy with low calories, and they're branded mostly as skinny. So the alcohol marketing has drawn, of course, on feminine ideas, as I mentioned earlier. So wine and gin brands would use a feminized language of friendship and, besties, BFFs, the girls, girlfriends, sisters, queens, ladies in my life, to promote the feelings of bonding and solidarity and to encourage group drinking. And of course, there's that idea of the equality and feminist ideas of independence that later on evolved, which kind of also encouraged the uptake of traditionally masculine brands with beer and whiskey. And then, of course, then when it evolved to more post-feminist ideas of empowerment, where you have fun, pleasure, experimentation, and of course, the sexual agency to promote alcohol. So one example is the mommy wine culture. So there's that thing where you get alcohol, the alcohol industry marketing alcohol as a way to cope with the stresses of motherhood, juggling multiple domestic and career responsibilities and mental health issues. It's like, oh, it's 5 o'clock or 6 p.m. I need my wine, kind of like thing. That's how they just present that. So the targeting and representation of women in alcohol marketing on Facebook and in Instagram has kind of evolved, but also very targeted. So we have influencer collaborations and competitions, those challenges, which were used to both target women and men. And drinking is often framed as a feminine practice and as part of doing, a combination of all the traditional and post-feminist and feminist identities. And of course, as I mentioned earlier, the marketing has reinforced and rejected also stereotypes to promote alcohol use. So there is a move away, in current trends at least, there's a move away from sexualizing and demeaning women to the appropriation of feminist and equality messages that will appeal, of course, to a wider range of women, including those embracing feminist identities. And although this is a more global trend, in the Philippines, it's a mix of both. So, for example, we have here, I wouldn't name names, but we have here San Miguel Light advertising and San Miguel flavored beer advertising, and this chill Spike Spirits advertising. And these are all screenshots from their Facebook pages that I screenshotted. And most often they are, of course, as I said, flavored. They're branded as a light or low calorie. And it's a way to mislead consumers on what on the health effects of alcohol, of course. So the alcohol industry also markets its products to all genders, not just women. So And it claims it promotes empowerment. And most of the time, it appropriates a lot of the gender identities. For example, Absolute Vodka and Sprite, the ready to drink cocktail that they launched in the Philippines last year. They started out rolling out advertising about hanging out. It's the new going out. It's the spirit of bonding, of course. Then, of course, Absolute has been doing this kind of advertisements for a long time, appropriating the Rainbow Coalition and the LGBTQIA. Um, and of course, recently, White Castle, and I know most of the Filipinos here would understand what I mean when I say that they have been trying to appropriate uh, and promote their alcohol products with different ambassadors from different genders. So there's also a more global example, the Johnny Walker Black Label limited edition of the Jane Walker. And they were very blatant about it that they introduced the brand to attract women to drink Johnny Walker or Black Label. And there's also, of course, the example of, again, bonding as part of the promotion, as you can see here with San Mig Light. So, as you can see, so alcohol pops, wine coolers, malt beverages, flavored and low alcohol beers and wines have all been targeted towards younger drinkers, casual drinkers, and women. And beer, most of the time, and the harder liquors have been targeted towards men between 30 to 50, and of course, underage and college age drinkers, usually through sponsorship of sports. And that's mostly from like the evolution of alcohol marketing. And the problem is the alcohol marketing strategies increasingly use gendered approaches, but policy is often gender blind. So I screenshotted this from the report from the WHO on gender responsive strategy and gender responsive approaches to the acceptability, availability, and affordability of alcohol, where they show how the alcohol industry and societal norms influence men and women's alcohol consumption. So, on one hand, you have the alcohol industry where the drinks are marketed differently to men and women and increasingly targeting women through, as we've already covered, gender-specific design, packaging, and advertising. But on the other hand, we have society where women are more harshly judged on their behavior and appearance if they consume alcohol, while men's behavior is more likely to be excused if they have been drinking. And this, of course, reflects wider gender norms, not just on alcohol. So, what are the psychological and social tactics in alcohol advertising targeting women? We've already mentioned some of them, but mainly three things. Here, alcohol is marketed as a way to cope with the stresses of motherhood, with the mommy wine culture. And then there's also it's also marketed as a way to cope with mental health issues related to motherhood. There's also that tactic of promoting alcohol as a means of relaxation and escape from the pressures of work, which can often lead to harmful drinking habits to deal with workplace stress. And I don't know how often you see this, on Friday nights where work colleagues would come together and have a drink. Not dinner, but actual drinks. There's also, of course, the tactic of exploiting emotional branding, and this has been there for a long time, where the alcohol marketing appeals to emotions, desires, and emotional needs. And more often than not, this kind of branding can exacerbate mental health issues because when women turn to alcohol as a coping mechanism, it doesn't really lead to better health or better mental health. So another one from the literature is when alcohol companies exploit girl power. This has been mentioned earlier. And this is when the alcohol industry would align themselves with female empowerment and the promotion of women's causes. I already showed you earlier the Johnny Walker edition. And that was part of a campaign to raise money for women's causes, where they would donate part of the proceeds from the sale of the product to women's groups, certain women's groups in the US. And there's also, of course, where the girl power or feminine power, female power, has been used to create new markets among female consumers. And because of this kind of promotion, the alcohol industry has or is being portrayed as progressive industries or socially responsible industries. And that kind of messaging also supports the industry's image as important social partners, as much as they want to be social partners, even though they profit from alcohol harms. And because of this, there is the likelihood of not having any regulatory controls on their activities, especially on marketing. So, some examples to show you. Of course, we have, the very common, and especially in the Philippines and other parts of Asia, where we have beer girls. And it's not just with Heineken. We've seen this with San Miguel, with Danwai, and all of that. And then, of course, you also have calendar girls. And this is one thing that irks me a lot. As a woman, it doesn't really empower me to see women in calendars like that, even if it's Miss Universe, you know. And I don't know if I'm alone in that, but it doesn't really help. And unfortunately, the Philippines has a history of alcohol marketing where women, celebrities, and role models are in alcoholic brands' calendars. And most often than not, in their public relations or their PR, the women are often saying that it's a privilege or an achievement of theirs to be featured as calendar girls for these alcohol products or these companies. So, for example, Miss Universe 2015, Pia Wurtzbach, she said, "I'm proud to be part of the Ginebra San Miguel family. I'm even prouder to represent an iconic Filipino brand that's trusted and recognized all over the world." And it kind of, as I've quit drinking since 2017, and this has kind of doesn't reflect anything that is empowering, to be honest, especially if you're promoting something like alcohol. And in the Philippines, it's also a very common thing to have alcohol advertisements invoking nationalism. And this was very common during the time when Pia Wurtzbach was promoting Ginebra San Miguel. And this was in 2019. I took this photo on the way to the airport where, it says Filipino ako, I am a Filipino. And of course, it also is guised as a public service announcement. There's drive safely, but there's also that alcohol there, right there on top of drive safely, which kind of makes us think, is this a public service announcement or is this an alcohol advertisement? So, and there's also that barely visible drink responsibly health warning somewhere in there. Um, and of course, just to give you more examples, with women in alcohol marketing, featured in alcohol marketing, invoking friendship and bonding. You have several examples here from San Mig Light, where you have the tagline, "Get into the light life, in the mood for fun." And then the Absolute Vodka and Sprite, ready to drink alcoholic cocktail, or hanging out is the new going out. And then there's one here from Tanduay about cocktails. I didn't catch the tagline here, but this is from Facebook. And there's another one here with Jack Daniels and Coca-Cola, where you see that the people featured in that photo are actually women, for an epic despedida. But what is the problem here? So gendered differences, there are gender differences in alcohol harms. So women who drink alcohol are more likely to suffer more alcohol-related health harms than men. And this is a more physiological issue rather than gender. And I can show you here, but I will not break down everything that happens to a woman's body when you drink alcohol. But I think one of the things that, especially with women my age, is, for example, the issues of um, potential miscarriage if you drink alcohol during your pregnancy. And of course, stillbirth or long-term damage to the unborn baby, which we call fetal alcohol spectrum disorder. And of course, there's also other effects on your liver, your kidneys, your blood and circulation, your heart. So, and basically the whole of the body. So women face higher health risks than men, and should be emphasized a lot because women start to have alcohol-related problems sooner and even at the same amounts when you drink the same amounts as men. And this is more because women have less water in our bodies, in their bodies. So the amount of alcohol in a woman's blood tend to be higher than a man drinking the same amount of alcohol. And women are more likely than men to experience hangovers and alcohol-induced blackouts at comparable doses of alcohol. And I'm pretty sure most of you who have been in drinking sessions or inumans know this very well. So women who regularly drink are also more likely to develop liver damage or what we call alcohol-associated hepatitis than men who drink the same amount. Unfair, right? There's also the problem of women being more susceptible to alcohol-related heart disease than men. Even, if they consume much, much less alcohol over their lifetime than men. Alcohol use can also cause brain damage in women more rapidly than in men. And of course, the inevitable, unfortunate uh, uh, breast cancer, which has been established in the literature, in scientific studies, that one drink per day can increase a woman's risk for breast cancer by 5 to 15%. And women who drink during pregnancy, as I said, can lead to fetal alcohol spectrum disorders in their children. And women who drink during their pregnancy also increase the risk for preterm labor. And of course, women who drink excessively have poor quality of life with higher rates of depression compared to men. So what's the situation in the Philippines? So in terms of alcohol use, and I don't know if this has been covered before in previous webinars, but from 2019 data, the Global School-Based Student Health Survey reported that 19.9% of female students aged 13 to 17 are current alcohol drinkers. It's 20%. Almost 20%. 20% of female students aged 13 to 17 drank so much alcohol that they were really drunk one or more times in their life. That's children aged 13 to 17. Just imagine that. And then you also have 52% of female students aged 13 to 17 drinking alcohol for the first time before they even turned 14. It's very early to drink alcohol. That's like 50%. And 24%, this was 2015 data, where they recorded that 24.3% of Filipino women are current alcohol drinkers, and 40% or almost 42% of current female drinkers have been engaged in binge drinking. So when you look at it, I don't have the graph here, but there was a graph somewhere in the report where they showed that women are almost at the same rate in terms of binge drinking as men in the Philippines. So the problem with this is that in the Philippines, we have self-regulation in terms of alcohol marketing. So in my research, in my PhD research, I covered instrumental and discursive power. And the alcohol industry's instrumental and discursive power can be shown very well through the promotion of self-regulation or voluntary codes. And they often posit this as corporate social responsibility. And because of this, when they frame it like that it's corporate social responsibility, that they are volunteering to regulate themselves, which really doesn't work. It's like dieting. with no one to actually, or with no nutritionist to guide you on your diet, that, it wouldn't really work. Um, so there's a lack in the Philippines. We don't really have any comprehensive or effective regulations on alcohol marketing. When I did this study in 2019, I used data from 2016, and I compared the Philippines alcohol marketing regulations with the rest of ASEAN countries, and the Philippines scored zero because we really don't have anything, because everything is voluntary, it's all self-regulation. So what is the way forward? Well, first, denormalize alcohol, because in our society right now, alcohol is kind of a norm because of how present it is everywhere in our society. Whether you're at home, of course your parents would have a stock of alcohol if they drink at home. Or if you live alone, you would probably have some stock of alcohol in your fridge. One way to avoid it is to not buy a stock of alcohol. And maybe just, try to rethink your drinking habits. So there is a policy initiative called the WHO Safer Initiative, and it's 5 effective and evidence-based policy options the WHO recommends member states to implement to actually reduce alcohol harm. And one of the things is actually comprehensive bans on alcohol marketing. It covers advertising and promotion, sponsorship, and corporate social responsibility. And of course, you also have higher taxes on alcohol because price hurts, of course. High prices hurt. Restricting alcohol availability. And this is a pain point for me in the Philippines because alcohol is available everywhere. Whether you're in a sari-sari store, a 7-Eleven, there's alcohol. I remember being in the Philippines. I often visit the Philippines like at least once or twice a year. There, I've been living abroad for 12 years now, but the impact of alcohol marketing on me is still there. The uh, there was a rack in 7-Eleven, or I think it was, yeah, it was 7-Eleven, where they had a rack of rice packs and in 5 kilos in a shelf, and then on top of that is alcohol products, and I'm like, rice and alcohol products, are these all essential commodities? Of course not. Alcohol is not an ordinary commodity. There's also, of course, provision of screening and brief interventions, and this should be done in the primary care level. And this is often something that I don't see doctors in the Philippines do. They don't check with their patients if they drink. Most internal medicine doctors would actually ask, but not all. And then there's also, of course, the prevention of drink driving. And I think in the Philippines, we need stricter laws on drunk driving because it doesn't really deter right now. Drink driving. There's still a lot of incidents on drink driving. One example of how we can do about it, or how we can do this, is look at Norway's alcohol marketing ban. And they have had an alcohol marketing ban since 1975. So in Norway, you wouldn't see any kind of alcohol marketing. So it covers all media, including social media, product labeling, and also the packaging. It covers all goods with the same branding, so there's no chance for the alcohol industry to do like brand stretching. And they couldn't also the alcohol industry could not have uh, products with identifying features as alcoholic beverages. Again, the brand stretching problem. And they also ban marketing of alcohol with other goods and services. I often see in the Philippines, and this has been shown to me by my sister who lives in the Philippines, where when she goes on Lazada, drink or snacks would be paired with alcohol, and that's something you wouldn't see here in Norway. And I hope that it kind of goes away, because it's sometimes you just want a snack, but you don't want to drink, but then you're forced to buy something because buy alcohol because it's a package and they often are promoted in a cheaper package. So that's about it. Thank you very much.
Thank you, Dr. Amul, for that insightful presentation. We will now be moving on to our Q&A session. For those watching or listening online, we'll address your questions in the comments section, so please feel free to drop them below. First question, Dr. Amul. You were mentioning about how the Philippines scored a zero out of every other ASEAN country. So I think with that, well, we just had a quick follow-up question on how the other countries within the region, how do they also use feminism or empowerment narratives to appeal to women, if it's there, and how do their narratives po kaya intersect with traditional gender norms within the
Mhm.
country or the region as well?
Well, actually, it's not much different than what we do in the Philippines. In Malaysia and in Singapore, there's still the gendered norms, gendered alcohol norms, where they use women in advertising same way as we do, not as blatantly as we do, especially when you sexualize women in alcohol advertising, but they still use women. They also still target women in terms of, especially during holidays and also including Women's Month. There would be like promotions for women to buy alcohol products so that they will get other products related to being a woman, like rice cookers or Instapots or whatever. I've seen this in Malaysia, in Singapore. Yeah. So there's still that. I mean, that's unfortunately because a lot of the alcohol companies are also transnational alcohol corporations. So the marketing tactics don't really change that much when you cross borders. Yeah.
Okay, and I think coming from that, are there any best practices what we can learn from other countries? You mentioned like um in Norway, there is comprehensive marketing ban on alcohol. So maybe there's any other countries we can learn from. Um so this is for the Philippines or other Asia Pacific nations. You know,
I'm not sure about in the region. There's not much there they have alcohol marketing regulations, especially in Indonesia because it's a Muslim majority country. And that's mostly because of religious reasons. Also in Brunei, where they also ban alcohol. But that kind of ban is often it often comes with a very most people would say a very authoritarian tendency, which is weird because, one of the countries in the region who's considered a bit authoritarian is Singapore, but they don't ban alcohol marketing. If you go to Singapore, you would be surprised how often you see alcohol marketing, even in trains, in buses, outside of the bus as their like decor. I guess I've lived in Singapore for 12 years, so that kind of also uh has been imprinted on me for some reason. There was a campaign back during COVID where they had uh, branding of different um, locations in Singapore where they feature um, Singapore as part of the branding of Tiger beer. And that's something, I mean, it's not targeted at women, but that kind of tactic is also being used everywhere else. Uh, that alcohol or gendered marketing is also seen in Vietnam. So policy wise, it's a bit hard to address gendered marketing without addressing it comprehensively. So the solution is to actually, and I know people would raise their eyebrows at me when I say to just ban everything. And it can be done because Norway has been doing it since 1975. If countries say suddenly that they cannot do that kind of banning, and we can always say, well, Norway has been doing it since 1975. So why not? So yes. And
Yes.
I know
Good.
that's something that might be argued against because it's a whole industry. The our advertising industry is a big thing in the Philippines, of course, but there are other things that they can do advertising on.
Okay. Thank you po, Doc Gail. And building up on that response din po as well, we remember having a part in the presentation about denormalizing alcohol, which we really want to push in terms of our work in the health promotion program. Even WHO, we're citing WHO that there's no safe level of alcohol. So when it comes to that po as well, we also want to ask your insight on what do you think the role of public health professionals or advocates and even everyone else, everyone listening into this webinar, what can we do in countering the alcohol industry's targeted marketing and even the general marketing? As you said earlier, the main step is to actually look at marketing in general and not just the gender targeting of alcohol industries. So maybe you have any insights for us working
Yeah.
in this.
I mean, public health professionals uh, and health professionals in general should be able to say to their patients and to their colleagues, to their family, that alcohol is harmful for you because there's no safe level of alcohol. And in a way, that is something. I know sometimes the wording can be a bit strange for some people to hear, but it's like, what do you mean there's no safe level of alcohol? When people hear that, it's like, so I even if I just drink a drop or a sip, something like that, people would always ask that. And for someone who has not drank alcohol since 2017, I can actually say that life is different being sober. So that's something also that you can, as health professionals and public health professionals, to start with yourself. If people see how you're trying to control your own life and not be influenced by the alcohol marketing that we see every day, then, you know, it also speaks a lot about yourself as a person and as someone who is trying to live a healthy lifestyle. And I know there's a lot of drinks out there that's saying 0 calories, zero sugar, whatever, non-GMO, organic, but then it's still alcoholic. That is very problematic. That kind of marketing is just evil. If and it just is very misleading to a lot of people who are trying to be healthy, but then again, you have that temptation of alcohol because it's branded as such. And also, I think, you know, um, walk the talk, I think, is one of the key things for health professionals and public health professionals. That if we are talking about, unbottling the truth and all that, we should be able to also say that we have quit drinking. And I'm not saying that everyone should quit drinking. It's a personal choice still. But if you're thinking about your health, if you're thinking about your long-term longevity, right? Uh, you know, it should be in your, we had this thing in the early 2000s when I was in college where you have vision boards, right? Most people would have vision boards of some of them drinking in a with a drink in hand somewhere nice in the beach or whatever. But, maybe a vision board is you being healthy and being taking care of yourself. So, and I think health professionals, nurses, doctors, whatever field you are in the allied health, you should be able to also ask yourself and your family how they consume alcohol, and and flag when you see very harmful drinking behavior. So yes, that's part of the denormalizing. And just, there's another thing in Norway that I noticed living here. I've lived here since 2023. And one of the things they do during Christmas is that they actually cover alcohol, the alcohol bottles in the dinner table, so that children wouldn't see alcohol. So you remove the norm of alcohol in the family context. So that's also one thing. Um, I can say a lot more, but we have limited time. Thanks.
Okay, thank you po, Doc Gail. And as you mentioned, we do have limited time. So at this point, we want to ask you if you have any final remarks for our audience today.
Hmm. I think, um, aside from thinking about gendered alcohol marketing, we also need to think about it comprehensively. It's not just harming women; it's also harming a lot of our men. And I'm not saying this in a sexist way, but every alcohol marketing can lead to harmful effects, harmful drinking. And this has been shown, including especially to youth. And we can show, I mean, we've seen in my earlier slides about how women are also engaging in binge drinking almost at the same level as men. So that is very problematic. And I think the Department of Health in the Philippines should be very conscious of that fact that women are getting into the habit of drinking excessively as well. So thank you.
Thank you for Doc Gail. So that brings us to the end of today's session. On behalf of the UP Manila National Institutes of Health Promotion Program, we would like to thank Dr. Gianna Gayle Amul for sharing such valuable insights with us today. We also extend our gratitude to everyone who submitted questions and joined the conversation. So as we continue the Unbottling the Truth webinar series, we encourage everyone to stay tuned for our next webinar episode, which will be a CPD accredited episode on the overall effects of alcohol on health. So remember to follow our social media pages to know more and stay updated on future events. Thank you, everyone, and we look forward to seeing you in our upcoming episodes. So, Doc Gail, before we formally close this episode, we would like to invite you to a quick photo opportunity.